Thank you so much for everyone for joining. We'll just share a few welcome remarks and then we'll dive right in. Hi everyone, my name is Michelle Ferber. I am an MBA student graduating this year in a few short weeks. On behalf of the Student Leadership and Ethics Board of the Stanford C. Bernstein & Co. Center for Leadership and Ethics Center, I'm honored to welcome you to Columbia School's event, Pandemic Reporting with Lydia Ramsey, as part of our Leadership and Ethics Week. Leadership and Ethics Week is an annual event hosted by the Student and Leadership and Ethics Board, which is the student voice on ethical leadership activities at CBS. Our purpose is to foster a culture and safeguard a tradition of principled leadership throughout the Columbia Business School community. The board fulfills this purpose by developing, implementing, and monitoring programs such as this, which cultivates leadership, builds character, and promotes ethical executive decision-making. Leadership and Ethics Week is one of our signature programs, and we hope it helps current CBS students to become productive, moral, and caring future business leaders. Now to introduce our guest, today it is my privilege to be joined virtually with you all and Lydia Ramsey. Lydia is a correspondent for Business Insider covering healthcare. She joined BI in 2015 after graduating from Northwestern University. At BI, she covers everything from healthcare mega mergers, drug pricing debates, to pharmacy disruptors, to private healthcare startups that rack up high valuations, including Theranos, of course, and the new ways people are going to the doctor, which includes the changing footprint of the hospital. Most recently, she has become a COVID-19 correspondent, for better or for worse. I would also be remiss if I didn't mention that she's also a friend. So welcome, Lydia. We are so excited to have you.
Thanks, Michelle. Great to be here.
So we have today, the structure is going to be Lydia will give a brief introduction. Then we have a number of questions from you all. So they pretty much fall into three buckets. So one is the business model. So what does the business model of Business Insider look like? The second is the ethics and value of reporting. Lots of questions about sourcing and what the ethical standards are, both before and during COVID. And the last group is Lydia's areas of expertise, healthcare. So she's done a lot of great stories recently, so we'll be able to really dive into that. So with that, I welcome you, Lydia, to give a few remarks and kind of talk to us about what your life looks like right now.
Yeah, absolutely. So as Michelle mentioned, we went to school together, so good to see you. And yeah, it's been really interesting. For the past 5 years, I've been at Business Insider covering healthcare, as Michelle outlined, in a number of different ways. And so my world completely turned upside down about a few weeks ago, as I'm sure everyone did, when I started covering the coronavirus pandemic. We were a few days from calling it a pandemic by that point, but it was on the horizon. So yeah, like Michelle mentioned, my day is really spent talking to folks about the pandemic, what's changing, what's going on, especially here in New York on the front lines, which has been really interesting to kind of hear, what are the challenges someone in the ER in Manhattan is facing versus someone out in the ICU in a hospital in Brooklyn. And I'm based in Brooklyn, so that's been really interesting to be sitting in my apartment, having these conversations and hearing what's going on inside the walls of a hospital as I get to comfortably sit at home and do my work and reporting from there. So I spend my days right now talking to doctors, nurses, other healthcare workers, really on the front lines of this, which has been really interesting. I'm learning a lot about, what we're seeing when we see really severe cases of COVID-19. What does it mean for the lungs? What does it mean? There's apparently a lot of blood clots that are showing up, really spooky stuff. But yeah, it's been an interesting experience. It's definitely a departure to some degree from the business reporting I was doing before this. But in a lot of ways, obviously, the hospital business, the healthcare world is inextricably linked with business. So that has been interesting. And I'm looking forward to the next year or 2 or 10 of reporting on the fallout of this.
Great. What a great way to start us off, Lydia. Also, I want to mention, if you have questions, definitely feel free to raise your hand by clicking the participants button. And we'd love to hear as many voices as we can today, especially because we're a nice sized group. So with that, Lydia, why don't we start with the business model? So just from the top, what is the business model of Business Insider?
Yeah. So like most media outlets, we're an online-only business publication. We've been around since 2007, so we've never really had a print publication. It was digital first the whole way. So one part of our business is your pretty typical online news outlet business of, online ad revenue, which has been really interesting based on the updates we're getting from some of our executives and things. It's clear, and we're seeing this with other news outlets. The advertising business is really being wonky at a moment like this. Traffic has never really been higher for really big stories. A lot of folks are online, they're reading stories, they're taking in a lot of information about what's going on with their pandemic, whether it's the economy or it's the disease itself. But at the same time, ad revenue is down, which has really hit a lot of media companies quite hard. We're lucky enough that we haven't been hit yet, knock on wood, from a layoffs or furloughs or pay cuts perspective. But, it is something I think about a lot as a reporter, keeping it on the back of my mind. But the other part of the business is we have a subscription model. So part of our content is paywalled. That's usually stuff that is for a more specific audience. If I'm writing something about the coronavirus pandemic and it's, something that everyone in my network, I would assume, would want to read, my grandparents, my parents, things like that, we'll put it in front of the paywall as general news. But there is some stuff that's very industry specific, either healthcare or finance or other, everything from entertainment and how much money TikTok stars are making, things like that. It's really interesting how many people are curious about that. But that stuff goes behind the BI Prime paywall. So we have that subscription model. We've got the ad model. We do some events that I think brings in revenue as well. So it's kind of diversified as best as we can, because it is really tricky to make money as a media company.
Yeah, absolutely. So that brings us nicely to one of our next questions that we got from a few folks. So some media outlets have now turned towards making all of their content free rather than part of the subscription service. What is your take on that?
Yeah, I think it's a really delicate balance. Like a month ago in February, if you were reading my articles, they would all have been behind the paywall. Like the links we sent out earlier, I would have probably tried to sign everyone up with a free trial or something, because it probably would have been behind the paywall. But I think you really have to reevaluate what's going on and who is it for. And if it's in the public interest, you have to think about it in a different way. BI's not taken a very strong for or against stance on where coronavirus specific content goes, which I'm kind of grateful for, because as this continues for the next couple months, I think it's going to be tougher and tougher to make money as a business, and so having subscriptions as an option is a worthwhile one, but it is a really fine line. So one of the classic examples I give is in the beginning of March, I got a leaked presentation of what the AHA they had hosted a webinar, probably similar to this, where they had some experts on it, and they kind of gave projections about how hard this was about to hit the US. And at this point, we didn't know much about what was going to happen. We were seeing a bunch of cases in Seattle, but that was pretty much it. And so to give everyone this kind of picture of what hospitals were talking about and what they were interested in was really important. So I put part of that story out in front of the paywall, but the big, long slide deck that I'd obtained, I put behind the paywall, because it was a little bit more nuts and bolts. This is the industry. So that was kind of the way we tried to balance the two, get the public interest stuff, the numbers, the projections out in front of the paywall, and then the more full out presentation behind.
That was a great example, Lydia. I think during the intro, we talk about the Bernstein Center's goals of being an ethical leader, which can be really daunting. But I think especially in the journalism space, you have to be, you guys do set the standard and are those leaders. So what was that decision process like? Do you talk to your editors? What's the internal debate going on?
Yeah, I think it was certainly a debate among my editors and stuff. And I kind of made it really clear as a reporter that if I was going to put the story out, initially, I was we should put it out in front of the paywall. Everybody should know what's going on, what the conversation is. And so I got a little bit of pushback on that. So we had to find a compromise, which is why we ended up doing the 2 posts. So there's moments where we have those debates. Anytime I put a paywall on a story, I tend to have that debate with my editor. Should it be behind? Should it be not? There's some clear cases where it should be behind, because it's very specific and very industry focused analysis or something of that sort. But for the most part, it's a dialogue. It's important to talk to your editor, and then typically higher up editors can get roped in if we can't come to a decision.
Awesome. So then the next question, again, in line with all of these things we're talking about, how are you personally evaluated? What are the metrics that BI is looking for its reporters to hit in a way that makes you, put out your best work, but also feel that, you're helping the business as a whole?
Yeah, absolutely. I mean, it's important to know exactly what you're doing and who you're writing for, as well as how well those stories are doing, in my opinion. A lot of outlets, I've been really grateful to work at BI because it's been an outlet where, I have a pretty good sense of what my measurements look like from a quantitative perspective. But really when it comes to the pandemic and just kind of the new standards it's setting, I think about my goal is I want to keep driving the story forward. I want to focus on the front lines, wherever those stories might be, which is a bit different than I want to drive the news story focused forward on the front lines of healthcare more broadly, the new front doors where people are starting to go to the doctor's office. That's more of a business story. So those goals would be a little bit more attached to that, get the scoop, get the news out in the ways that business readers are going to want to be interested in reading. So quantitative goals, I've kind of, for better or for worse, put aside to a degree to kind of figure out, what are the most important stories I need to be telling right now. And if that story gets, a few fewer page views and I have a little bit more of a substantial post out of it, that's fine with me. So that's been interesting to see shake up.
No, I mean, it's great to hear that they're supporting you in that way too. I think that's really reassuring that you're covering the right things rather than feeling pressured to pivot a certain way or another. Okay, so just broadly, I think folks also want to know what are some of the biggest challenges, not only on the pandemic side, but just from the general economic collapse we're seeing. What do you think for journalism as a whole we see now as some of the biggest challenges and opportunities?
From a coverage perspective?
Yeah.
Yeah. So I think, one of the things I'm really grateful for is I have a really relatively big newsroom. We're no New York Times, but that's fine. And so it's been really great to kind of team up with colleagues and figure out where the really important stories are. A lot of what I've been asked to cover has been on the pandemic side. So what's going on, what's happening in the overwhelmed hospitals, what are we seeing, what's actually playing out right now. But at the same time I'm doing that, our markets team is covering, the economic crashing, the job, the unemployment rates. Every single story right now is kind of a coronavirus story. At the end of the day, I joke that every one of my peers right now is a healthcare reporter to some degree, which is interesting. Something they probably didn't expect to be doing, but it's really hit every single person's beats a different way than it ever has before. And I don't think it's going to change anytime soon. So we're going to see a lot of fallout specifically in the healthcare industry. That's for sure. It's already starting to happen. We're seeing a lot of furloughs and layoffs and things because elective procedures have been called off on the healthcare system front. It seemingly is hitting the health insurers a little bit less hard because they don't have to pay out as many claims at the moment. So we'll see where that goes. But it's really interesting. I think about, my life before February and the lives of all the reporters on our team were so different than what they are now. It's pretty substantial to think about, every single industry has a story here. So our retail team is covering, what's going on the grocery store front lines, what are the big changes happening there for sick leave and for, benefits pay for this kind of hazardous work that workers are now finding themselves in. What's going on in the airline industry as we start to see these shakeups. So it's been really, really great to see kind of a lot of those stories start to unfold. And I think we're going to see a lot more of that as we get to start to grapple with what this true fallout was.
Yeah, I think the piece about insurers is particularly interesting, especially as we see unemployment increase. People will lose their benefits. And then will they go on COBRA? Will they become Medicare, Medicaid? Even for students at CBS, for those of us graduating, there's a big question of what will our health insurance look like, especially for those who may not have a job for a few months. Right. The other piece, also folks, feel free to chime in if you have additional business questions before we move on to some more, ethical values questions. But the other thing I wanted to mention, Lydia, the piece about collaboration, I think is so fascinating because some industries we really see forming this coalition, healthcare, right? Folks are really collaborating more. You wrote an interesting article about, is it now the CEO of Optum leaving to work with Sanofi and GSK to sort of work together to develop these vaccines? So is that something that surprised you?
Yeah, I mean, to be clear, he went to go work with the WHO.
Oh, yes, yes.
Specifically.
Thank you.
But he did work at GSK, so that's where the little tie-in is. So I think that move in particular was really interesting to me. We saw yesterday, head of United Health Group's earnings. They said that their CEO of their Optum unit, which encompasses like the PBM arm, the pharmacy benefit arm, and a lot of the medical provider businesses, all of the medical provider businesses, things like that. So Andrew Whitty, who was a former GlaxoSmithKline executive, he's going to go take a leave of absence to go co-lead a team developing a coronavirus vaccine. And he'll be back probably at the end of the year. But it was really interesting to see that kind of move. I think we've seen in this response, as we've seen kind of the government players take different levels of responsibility. We've seen a lot of private sector folks kind of taking different steps, whether it's out of necessity or out of, innovation. I think a lot of that is up in the air at the moment, but we're seeing a lot of folks have to get creative to kind of figure out how to handle this. I think you saw a lot of folks on the employer side get really smart really quickly that they needed to have as much of their workforce work from home before the stay-at-home orders started going out. We saw that with like some of the big tech players first, but even BI, I was working remotely before I had to, mostly because I was too freaked out to go on the subway as a public health reporter. But yeah, it's one of those things where I think a lot of this has been born out of necessity. But I hope that it pays off. I think it's really tricky because you want to balance a coordinated response with kind of playing to people's strengths. So I wonder sometimes if we had a more coordinated response on the top, maybe we wouldn't be seeing as much of this kind of innovative or like on the fly decision making, these moves to go help elsewhere, showing up. But I think it is great to see, it's cool to hear about, the health system stepping up to go staff a field hospital or, lending resources. I was talking to someone based in Utah who flew to New York on Tuesday to come help in the kind of ICUs here in New York and kind of alleviate some of the healthcare workers who are here. So it's great to see kind of everyone wants to be part of this to some degree.
No, I think and it instills a lot of hope, right? To see people making positive steps in the right direction. So, okay, we have a question from Amanda. How has social distancing impacted your ability to fact check or find new stories of interest?
Yeah, it's a great question. So I have been really lucky that a lot of my stories I can do over the phone. So I'm talking to, sources, nurses, doctors, other healthcare workers, a lot of the times over the phone and while they're at home usually or headed home from their shift. So that's been good. I've been able to, connect with them online and then to get them on the phone, things like that. Fact checking, a lot of my job is, reading what's published in the academic journals online and things like that. There's not a lot I've found that I can't do by not doing something in person. That's been the great thing. A lot of our team was remote. For instance, my editor was already a remote employee by the time that we started this thing. He was working out of Philly since June of last year. So, it's one of those things where it wasn't too much of a shift to how I report. Besides, I miss the casual coffee source meetings, getting all the good gossip.
I'm sure. Yeah, it looks like Caroline has a question if you want to unmute yourself.
Hi, can you hear me?
Yep.
Great. Hi. So I worked in journalism before business school, and I'm planning on going back after. And I was at CNBC, so I have so much respect for journalists that are doing their job right now, and I think it's they're doing such important work. So thank you for continuing to do that. I guess my question is, so many times when we're looking for a story, you want to find kind of an outlier, interesting case, because that's really the impactful stories and the interesting stories that get readers engaged. But I've noticed that a lot of the stories that I see, particularly in this case, because it's such an unprecedented situation, are these outlier cases of, really young patients or, these heartbreaking stories that for sure should be told. But I feel like journalists aren't necessarily citing statistics in the story saying that this is a part of this age group and this age group is this affected. So I feel like it's almost contributing to a little bit more panic than it should be. Like, I guess I was wondering, what do you think we as journalists can do in order to, in this unprecedented situation, maybe shift things that we're not normally used to doing as much and what we can maybe do more of.
Yeah, I agree. That makes me think a lot of, the training I get as a science reporter. We're asked to kind of provide the context in a way that's like, making sure we're not just pointing out those outliers. So I think it is an important reminder to always look to the data. A lot of what is coming out right now is so anecdotal, even from a medical perspective. We don't have really good evidence to say, what kind of medications we can be using, which is why hydroxychloroquine is one of those really controversial topics at the moment, because we don't really have good data. So we as journalists need to figure out the best ways to convey that information, whether it's, adding a bunch more context about the age groups and how it's affecting young people. I was just actually thinking about a story about that, because one of the big feedbacks I've gotten from doctors is like, they're always so shocked at how young a lot of their patients are, young being a relative term, sometimes meaning like in their 40s and 50s, but in really serious cases. And so I think just making sure the context is there from a numbers perspective, getting that data in there, and also, looking into the scientific rigor, talking to experts, talking to folks who really know their stuff, and doing a lot of gut checking. That's been my personal guiding compass, and it draws a lot on my science reporting background. But yeah, I think it is really important to keep that in mind, even for reporters who might not, have that be the first place their mind goes when they're looking into a story.
Thank you so much.
So the next question we have, Lydia, is from Emily. So I think, you talked about the experts that you talk to. What is the reaction from these healthcare professionals that you work with? Are they, I know when we talked earlier, you mentioned some hospitals have certain policies, et cetera. How have you navigated that?
Yeah, so I try to reach out directly to folks, or, a lot of the communications teams at different hospitals have been really helpful in connecting me to folks. So that's been great. I try to find as many folks. There's truly, everyone has an opinion right now, and everyone is out there tweeting about it. There's definitely been a lot of coverage about how hospitals are starting to try to tamp down on that, which is really upsetting to hear. But I try my best to make sure that everyone feels secure in how they're talking to me. I practice the no surprise journalism, which is like, you're not going to know, you shouldn't see something written about you that you didn't know I was talking to you about. We should be on the same page about that. And so whether that's, being super clear about what does it mean to be anonymous, when I say I will write in the story, a nurse at X hospital, things like that. I try to lay it out as clearly as can be. And obviously, I try my very best, and I work with my sources on this to make sure that there's no identifying details, so they can't be, reprimanded for it, and things like that. But I've been really grateful that a lot of folks have been willing to talk to me on the record. They've been willing to talk to my colleagues on the record. And that's been, I think, really helpful, because I think a lot of people understand the necessity of, especially at a time like right now when visitors aren't allowed in the hospitals, the only people who know what's going on inside the hospitals are patients and doctors. And so and healthcare workers more generally. So it's really important to get that clear message out, as best as can be, because otherwise it can completely get misconstrued.
Yeah, totally. Emily, is there anything you want to add there? Or does that, I think I may have misrepresented her question a little bit, because she's also asking about PPE. I think that's been really interesting to see how the media has helped / I guess what's your perspective on that? Like this cry for PPE, which now maybe seems to have subsided a little bit. What's your take on that?
I think it's really, I think when we look back on the coronavirus pandemic, one of the biggest scandals that's going to be seen as part of this is going to be the fact that we put our healthcare workers in a position where they did not feel safe doing their jobs. I think it's really important to think about the context in which people are talking about this conversation around PPE. So basically, because this isn't, a virus it's not airborne, it's spread through, aerosolized particles, and we're trying to figure out exactly how it's spreading, how infectious it is. There's a lot of unknowns, and there's a lot of scariness associated with it. And if you are telling people that N95 masks, which tended to be worn only when dealing with certain patients, usually tuberculosis patients, and usually one-time wear kind of items, and now you're telling them completely different guidelines, it makes all the sense in the world that people are freaked out. It makes all the sense in the world. When you look at the numbers, out of, the CDC came out with numbers this week that were saying that close to 10,000 healthcare workers have gotten sick from this. Whether or not they picked it up in the hospital or elsewhere in the community is a bit of a mixed bag, but it's important to think about, because if you're not feeling safe and protected, it's really tough to do your jobs. So I think that, getting those stories out there is an important way to put pressure on folks in a way that's different than, raising the flags internally. A lot of the folks I ended up talking to for stories around that were folks who had raised the flags internally as well. But even the hospital systems as a whole are starting to call it out. They're creating face shields out of office supplies for their employees. They're, putting it into the reports back to the Health and Human Services Inspector General. So I think it's one of those things where everyone knows this is an issue. And it makes a lot of sense. It's at a volume that we've never really had to use before.
Yeah, thank you so much for that. Okay, our next question is from Charles. Do you want to unmute yourself? He's such an eloquent speaker that I want to give him.
There we go. Hi, thank you so much for joining us. Obviously, I feel like media is so central to all of our lives right now. Just it's the way that we're accessing all information. And, as New Yorkers, which a lot of us are on the call, we expect New York to get an outsized, a share of the media attention. But it occurs to me that in the case of coronavirus, it's been so dominant, especially Andrew Cuomo's contributions to advocating on behalf of New York State and healthcare professionals in the tri-state area. Do you think that this is warping our national coverage and overlooking certain other areas that may be more optimistic or more pessimistic, but we're just not giving any attention to it? So I guess I just want to hear your impression of what the New York share of media is doing to the overall coverage.
Yeah, it's a great question, and one I think a lot about. When I first kind of set out to understand how health systems were going to respond to this, I looked at it pretty nationally. We saw obviously Seattle was a major hotspot and the kind of front end of this, given a lot of the disease burden that was happening in nursing homes and things like that. I think that a lot of the media coverage, why Cuomo's a big voice in this, things like that, is sheerly the number of cases in New York completely eclipse. I think it accounts for 20% of all cases in the US. It's such a massive population that's gotten hit hard here. And I think that the media coverage, at least from where I've sat and what I've been directed to do, I've been told to look specifically at New York because it is going to be it was the story going through the end of March through now that we're in the plateau. Hopefully it's less of a story. I don't think that other cities in the US were hit as hard as early. And that's important to keep in mind. So I think you would start to see, for me, I'm starting to think about what are the next hotspots? What are the next areas that are going to be hit hard? I think we're seeing a lot of that debate go down in Michigan, especially, and kind of the Detroit area has been hit particularly hard. We see it in New Orleans. Chicago seems to be plateauing. Luckily, it seems like a lot of places around the US are getting hit in much different ways, which I think will bring up its own stories, but we have a bit of a headway or like a little bit of breathing room, not like a ton, but it's not the same intensity as what hit New York. What hit New York is really specific, and hopefully we don't ever see anything like that happen again. We didn't see it in LA, we didn't see it in San Francisco. So hopefully it was just New York, but that's how I'm thinking about it, because I think there is a reason to think about it as an outlier from a media is based here kind of perspective. But interestingly, like as I was doing my own reporting, I was finding it hard to find a lot of local news on it, just based on, like, it's weird to think about, but New York's local news scene has been kind of decimated. We've seen a lot of outlets shutter, a lot of people laid off from places like the Post and the New York. Guiltily, I don't subscribe to any New York papers, which I definitely should. But it's weird to think about, because the way that I report on a story, the way a lot of national media outlets report on stories is a much different view than local news. And I found myself really missing those voices a lot when trying to zoom in specifically on New York, I have to say.
Yeah, thank you, Lydia. It's interesting, even here. So I'm in Miami right now. It's none of the same people I recognize are even on the news, right? It's different folks that are coming. So I think it just depends, right? Because if you're out interviewing people you're exposed, maybe those folks are getting sick, unfortunately. So one of your other recent articles, you interviewed Dr. Vivek Murthy, right? Is that how I say his name? A former Surgeon General from 2014 to 2017, and discussed this concept of a social recession, where, people, not only do we have the economic impact, the health impact, but now people are also feeling disconnected and lonely. So we're starting to hear a lot about that from provider stance, but as a reporter, I would imagine it's pretty tough to constantly kind of be sourcing these news, hearing from the front lines. How has that impacted you?
Yeah, it hasn't been easy. I mean, it's one of those things where usually when I'm reporting on healthcare, I can totally compartmentalize it, right? Like if I'm covering people who are, living with one particular chronic condition, or, if I'm talking to patients who are living through end-stage cancer, that's an experience that I personally don't have that much of a personal experience with, luckily. And so there's a way of me kind of compartmentalizing it that's totally different from right now. The things that are happening in my reporting world are also happening to my personal world. The same kind of debates about family and, what to do if kind of faced with really difficult questions, like what to do if a grandparent gets ill, things like that. And I think recognizing that and knowing that it's okay to kind of get overwhelmed sometimes. I've definitely gotten overwhelmed some days. I just need to sit and decompress after going on a grocery run, or, doing something else that once was not a stressful thing. And now it is. And it just keeping that in mind, and also setting boundaries. I tried my very best to, when I'm on, I'm on. And when I'm off, I'm off, which was really hard to do those first couple of weeks when the news cycle was 25/7. It was really quick and fast, and everything was breaking news all the time. Luckily, things are slowing down, and we're kind of getting into a bit of a routine. But it's, for me, just understanding that I am both reporting the story and living the story in different capacities has been a big thing I've had to swallow, I will say.
I mean, it's consuming everyone's life. So,
right.
We were talking a little bit earlier that I think there's been a wide variety of reactions to coronavirus, right? Like some people are taking this on as something they can do to contribute and finding different ways to have an impact. And for other people, it's just overwhelmingly stressful. So,
right.
But I think what you're probably in the doing a lot bucket, I would say, right, Lydia?
I would say probably in both buckets at the same time at different points. It's tough. Everyone is getting hit by this. Our whole worlds are going to look a lot different when we come out of this than when we entered it. And for a long time, even understanding that that's the reality I'm talking about it was a big pill to swallow, for sure.
So you sort of alluded to this earlier that, COVID-19 has become all-consuming. We got a lot of questions about what happened to the non-COVID news. What would you say to that?
There wasn't that much non-COVID. Honestly, it was really interesting to watch this happen, because I was not a denier, but I try my best to hold on to what I understand, what my routine is, what stories I was on the hunt for before this kind of took over my life. And off the bat, I was like, oh my gosh, either the stories I was chasing completely got put on hold. Everyone the company I was talking to had to figure out overnight, what to do with their workers, what to kind of do with their business model, how to shut down, how to make changes. Any leads I had at the start of this are, a much different story now. I mean, this is an all-consuming story for everyone. I think a lot of stories, some people were trying to pitch me on really interesting ideas for new health insurance startups. That was something I would have jumped on immediately if it wasn't a pandemic. But they pitched it to me at the height of the pandemic, or at least the New York part of it. And so I couldn't cover it at that point. I think a lot of people's priorities shifted for really specific reasons. And hopefully that won't ever, happen to the same magnitude again. But I do think that, I'm thinking a lot about what stories I might have missed during it, in the sense that what companies really imploded, what companies really had to take a hard look at themselves and say, this is what our business model is going to be going forward. Here's what it isn't. And I think we're only now starting to see those stories play out. We've seen, a lot of layoffs happening in the tech industry. And some of my colleagues over there have been really great at following along with that. I think a lot about what the fallout is elsewhere that we missed in the month of March, for sure.
So do you have any tactics to help you kind of navigate these blind spots or things that you're looking to?
Well, I think about it a lot more in the context of like, there's a million stories I can write on any given day. How can I write? What can I do that's going to A, best serve the reader, and B, the best story that I can personally write based on the skills I have. So for right now, that is, looking at the evidence that's out there about what's going on the front lines and really drilling in on that. And that might be a different answer tomorrow, but I have to just, I can't write every story and I can't be everything. So just telling myself that and keeping that in mind has been really helpful. But I think in terms of the blind spots, I personally am thinking about it in the sense that like, I'll probably in a couple weeks take a minute and go back through my inbox and think through some of the things, like the meetings I had right before everything shut down and kind of pick stuff up there. So it's not so much of a, I think they're all important stories to be telling. The priority order just gets a little bit more shifted.
I think that's a really good takeaway, like just the importance of having that moment of reflection because things are changing really rapidly right now. Mm-hmm. So you sort of alluded to, obviously the whole world has changed. Do you think that there are any changes that have been made in like the way the media reacts or your reporting that you think are here to stay moving forward?
Oh, that's an interesting question. I think a lot more people are going to be thinking about stories from a health perspective now, which will be interesting. I've noticed a lot of people jumping on my beat from my BI team. And so talking to them and getting to know them and teaching them what kind of questions to ask, how to help has been really interesting. I really hope that the speed at which we all have to do this is slowing down again. I hope that's not the part that's here to stay, but just being flexible and understanding that, this story is a moving target, things are changing overnight. One of the things that I think will be a prevailing theme going forward is, what parts of the healthcare system are completely fundamentally changed. And I think having that scope will be something that, for at least personally, that'll be the thing that remains after all this, after the kind of dust settles.
I mean, we heard earlier this week from someone who maybe Amanda might be able to help remind me. She has some role as an admin for OBGYN at Columbia Presbyterian. And she said, like, they're fully doing telemedicine now, which before they were in pilot. So like how patients aren't going to go back, like that's here to stay. So it's good to see some of these things we wanted for a while are being updated. So one of the other questions sort of taking us in a different direction, but that we had that was pre-submitted that I think is interesting is I think the media has this delicate balance of like obviously reporting accurately, but balancing the fear that they instill in people versus promoting fake news, if you will. Mm-hmm. What's your take on that?
Yeah, I think from an ethical perspective, it's really important to keep that in mind at all times. There's a world in which, outlets can think about things purely as like what can I put in a headline that's going to get the most clicks, right? Like that's a really straightforward way of thinking about it, but it's a way to think about it. And I think, having folks on your team to kind of talk you through stories, work with you. That's why we have editors. That's why we have, teams of people to work with, is to bounce those kind of concerns and balance it all out, right? Like at the end of the day, there's a lot of scary stuff out there and I want to make sure I'm appropriately reporting on it. So, usually I'll have an internal debate with myself. Like, am I overstating this? Am I understating it? That's when I'll go back to like experts and either, outside of BI or within BI and really do a lot of gut checking. It's really hard when things are moving quite quickly, especially if someone a world leader says something very alarming, it's probably going to get written about. I think at that point, you have to really think through the context and the caveats and make sure those are in the story to kind of our earlier conversation about that. And making sure that, we're not scaring people for for the sake of scaring people. That's not the business we're in. We're in the business of informing folks. And so keeping that in mind at all times is really important. Plus, like, we as reporters are getting freaked out too. So, I mean, at least from where I sit, I know for me personally, I've never felt uncomfortable with the severity of a headline going out. Like, but I mean, we're not there to hold people's hands either, right? Like, at the same, we have to report the facts and we have to report what's going on, as scary as it might be.
I mean, it's such a delicate balance. So related to this thought of prioritizing stories, Charles asks, how does BI utilize its top stories function and front page display space to find that balance, either furthering its own objectives or, I guess the paywall versus non-paywall content, et cetera?
Yeah. When it comes to the front page, that's something I am not involved with to a huge degree. I know that, we'll ask to put stories on there that we think are relevant and important to people. I think you can think of the front page of anybody's website at this point is really trying to replicate the front page of the New York Times or the Wall Street Journal at this point. It's trying to replicate what we had in the times of print journalism. We want you to have that most important story up at the top, and hopefully that story, it's an editorial decision of what that most important story is. I think in all those decisions, the fundamental news judgment is at the core of it. Whether it's, usually we don't put prime stories up at the top there, but say we would, I don't know. It's always an editorial decision at the end of the day.
Great. Looks like Caroline has a comment, and then after that, we'll get to the question that someone sent me in the chat.
Sorry to ask another question. I've noticed that there's like this dichotomy of public opinion over oh, this is not as big of a deal as everybody's making it. Like, we shouldn't shut down the economy. And then of course, this is a very serious pandemic, and that's kind of the dichotomy. And I was wondering, as a journalist, obviously what we report on is based on what the experts are saying. And there's so many different experts, totally unprecedented, saying completely different things. How have you dealt with that as a reporter? And how is that, how are you kind of dealing with that dilemma?
Oh, it's so overwhelming. One of the big things oh, sorry, there's a weird echo going on.
You should be good.
Okay. One of the big things I've heard, I heard it from I was on a webinar with the Journal of the American Medical Association, and they were talking about all the models of what this would look like. Those scary, 2.2 million people are going to die in the US kind of figures. Those models, they were talking about how many of those get submitted to the journal on any given day. And they said that they aren't publishing any of them because it's just, overwhelming. And there's so much that, it's models. It's going to change all the time. I think for me, what I've been doing is I'm trying to, if there are a lot of conflicting things out there, I try to put them all together, whether it's, bucketing hey, I'm talking about this projection and these kind of what Cuomo thinks is going to happen in New York. Here's, to be sure, this might not happen to that degree. Here's another way of looking at it. I think trying to balance all the different perspectives is important and completely difficult. And it's something I think everyone has to think about all the time, because there are a lot of conflicting ideas, and it will look like we overreacted at the end of the day. If it means that places don't get hit as hard by this in the first wave as they might have, that's very good.
Great. Next, Arun, do you want to unmute yourself and share your question?
Sure. Yep. Thanks, Michelle. So, Lydia, could you elaborate on how the pharma industry is going to shape up for the next year or two? Not immediate now, but next year or two. While you are doing it, can you talk about more on the industry priorities of after the pandemic is over? What would be the worker mindset or change in any worker style or the work, and problems that we will be seeing it after the pandemic?
Sure. on the pharma outlook, I think we started to get our first kind of hints of that from Johnson & Johnson's earnings on Tuesday. They talked a little bit about what parts of their business were being hit. Obviously, they make Tylenol, so Tylenol sales have gone quite well because it's a way of managing symptoms. But they did make a note that I found particularly interesting for the pharma business model in particular, which was, as people are doing telemedicine, staying home, not going into certain visits, they did see a kind of somewhat of a drop off to some of their claims checks and things that kind of indicate how many more new people are going to start a prescription for certain chronic disease management and things. And that's an important indicator for pharmaceutical sales. So I think that there will be a really interesting shakeup over the next year or two for pharma to kind of grapple with, is this going to be a blip? Is the putting off of elective procedures, putting off of office visits? It's sounding like people are expecting that to come back online by the second half of the year, so starting in July. But if it becomes more prolonged, I would imagine we start to see more of a hiccup there. And then to your questions about, the kind of, was the question more about like the future of work more generally, or for the healthcare industry?
More for pharma and healthcare industry is kind of like a side, but predominantly future of work for pharma. Yep.
Yeah. I think one of the big things I've been thinking a lot about is how much work has been sidelined at this point. We've seen a lot of people have trouble continuing their clinical trials and, developing their drugs. A lot of my colleagues have written a bit about that. It's really interesting to think about, what are the long-term implications of not having that research ongoing? I think we've seen pharma as an industry work at such a specific rate and come out with certain drugs at that rate for a really long time. And a lot of folks have either shifted to looking into new COVID-19 treatments or vaccines, which is great. But it does mean that a lot of other disease areas, cancer, neurodegenerative diseases are getting put largely on hold because people can't come in to their academic medical center nearby to do a trial because it's completely swamped or just you need to, if you're an immune compromised patient, you shouldn't be coming into a hospital at this point, things like that. So I think that'll be the biggest fallout I'll be watching in the pharma industry is just what happens to those trials, what happens to that research.
Okay. And does it create any new problems? Or once the pandemic is over, are there going to be any new problems which we need to look into it or see it in a different perspective?
The way I'm thinking about your question, and let me know if I'm answering it kind of wrong. I think the pandemic surviving COVID-19 in its most severe forms we're just starting to see what recovery looks like. A lot of folks seem to be doing quite well, especially if they have more mild forms of the illness. But in pretty serious cases, I think there might be some fallout of what kind of, lung damage or, clotting damage is happening in the body. And I think that'll be interesting to see how pharma has to react to that.
Got it. Okay. Thank you.
Mm-hmm.
So we have about 10 minutes left. I know we've covered a lot of ground. Is there any reflections you want to share also to the group? And it looks like we do have one more question. So I'll ask this first and then I'll re-ask you to share your general reflection. So, how does BI handle COVID reporting in balance with politics? How do you report on national state response devoid of politics, or is that even possible?
It is hard. That is for sure. I think luckily we have a really big politics team and they kind of take on a lot of the brunt of, what Trump's saying, what governors are saying, kind of that coverage. So I stay more in the scientific realm. I think for me personally, what I think about at the end of the day is, I'm here to report on what policies get enacted, what statements get made that are like clearly linked to an action. And I try to link up my reporting a lot to that. So if a state mandated that insurers cover all the costs of COVID treatment or testing or both, that's what I'm going to cover versus kind of what snippy quote they might have said at a press release or a press conference. There's certainly room for both, but I tend to have that former idea that like what is tangible, what's actually happening, kind of drive a lot of what I have been ending up focusing on.
Awesome. Looks like Simon also has his hands up.
Yeah, thanks a lot. I know we've talked about this already quite a bit in terms of reporting about COVID-19 and then everything else that's happening in the world. What I'm interested in is, do you think there's maybe a room for media outlets to differentiate themselves coming out of this pandemic? I mean, right now everybody's reporting about the pandemic, and that's sort of the consumer expectation as well. But I see the same information across all of the media outlets. So could maybe one of the results of this be that media outlets become more differentiated and try to specialize more, so that I know if I want to read about maybe the industry perspective, maybe the unemployment perspective, that I go to a certain media outlet? Because right now I feel like I read only about COVID, and I could read it anywhere. I could get the same information, and I'm kind of stopped reading it because it's depressing anyways. So, is there maybe room for innovation or differentiation going forward?
I hope so. I think that's one of those things we're going to start to see as we, like, some of the big, like, shocking bits of this. I think everyone was, I think rightfully so, the headlines are pretty focused on, the immediacy and what's going on a national level. Like, we've probably in the history have never seen a global pandemic play out this way on national media before. But to your point, I think what I'm grateful for is I have a lot of colleagues chasing a lot of those stories. What is the fallout to Starbucks employees? What is the fallout to, where the future of the pharmacy goes? Things like that. I've been really grateful to see a lot of my colleagues look into that, what's going on with small businesses. I think a lot of outlets, or at least BI, is thinking a lot about where can we play to our strengths that we came into this with. When I think about BI's coverage, we're trying to get the inside story. We're trying to understand, like, what's going on inside companies, and so that's worked out well when I'm trying to get inside hospitals. So a lot more specific, but, I think hopefully coming out of this, we have that perspective. So hopefully, we'll hopefully all play to our strengths. Forbes will talk to the billionaires about how they handled it. Fortune will talk to the companies about how they handled it, things like that. So I'd expect to see that start to become more of the focus. But I think for now, a lot of my understanding of this is, we have to cover the news where it lives. And if that story is the same, that's going to be on 10 different outlets, that's just I don't know. We have to use our news judgment and go to where the story is.
Thanks, Lydia. So yeah, I think we'll return to maybe any general reflections you have, and then we'll say a few closing remarks.
Yeah, I mean, it's been one of the most, I'm sure for everyone here, it's important to keep in mind that, this is a really big change to our reality. And it's, as I've kind of been reporting on it, I think one of the big takeaways I've learned is, like, this is maybe the biggest story of my young career, and it's likely not going to go away anytime soon. And it's likely not going to change the way I live my day-to-day life anytime soon. And so keeping that in mind has been tough, but something that I think is important.
I have to say, Lydia, like, this hour has flown by, and I also feel, one, thank you so much for joining us. Two, I feel like inspired and so grateful that people like you are reporting, who are so thoughtful and really like thinking seriously about the implications that your reporting has and how to do it in a way that's responsible. So with that, I think we will close out. And again, big thank you, Lydia. One more plug. We have a few Bernstein Center events left. So feel free to join us for a chat with Melissa Berman tomorrow and tonight for a workshop.